Hi, I'm Dr. David Ross, and I want to tell you more about our software Neurogage and how it allows us to analyze longitudinal change over time in brain volume, which is very important for understanding the effects on the brain of traumatic brain injury and many other brain disorders. We began working in this area in around 2011, and to give you an intuitive idea of the importance of longitudinal analysis, I'm going to tell you my story about the incredible shrinking man. Imagine a patient comes to my office and he says, "Dr. Ross, I think I'm shrinking." And I measure his height and I say, "Don't worry, Mr. Jones, you're 5 feet 8 inches tall, perfectly normal height." And he says, "But Dr. Ross, 1 year ago I was 6 feet 2 inches tall." And I would say, "Oh my goodness, that makes a big difference. That means you decreased your height 6 inches in 1 year. You must have some terrible problem going on." That's the importance of the longitudinal design, having a baseline measure in a person and then comparing that to the person's measurement at a later point in time. It's very important in science and statistics and in brain volume measurement. Here we have a morph movie which shows you a good graphical demonstration of that in the brain. This was created by the talented Michael Havranek, who works with Amicus Visual Solutions. And on the left, we have a CT scan from our patient on the day of the brain injury. And on the right, we have a later MRI scan. And these scans were done with an axial section, which means it's a section through the brain approximately through here. And you can imagine these as the patient lying on the table with the feet coming out towards you. And so the patient's left ear will be on the right side of your screen and their right ear will be on the left side of your screen. When you look at these from before and after pictures, although the resolutions and the lighting is a little bit different because one is CT and one is MRI, two different technologies, you can still see the main brain structures. And the question is, do you see any change looking from left to right? And you may or may not. If you look really hard, you might see it. It's subtle. It's hard to see. But when Michael Havranek did the morph movie, and we play it here, you can see as you watch it change over time that the right frontal lobe atrophies, that is, it shrinks. So it's much easier to see the change over time, and that's the point we're making here. Another example was done with a three-dimensional reconstruction of the ventricles in a different patient of ours, also done by Michael Havranek. Again, if you look at the before and after images, and these were done more than 2 years apart, it's hard to see a difference. But when you play the morph movie from time 1 to time 2, you can see that the ventricles are expanding. And if you look at the temporal horns, you can see they get a little bit longer, for example. And this patient also had traumatic brain injury, and the ventricles expanded because the brain tissue around the ventricles was shrinking. And that's what happens with brain injury. When the brain tissue shrinks, the ventricles get larger by default to take up the extra space in the brain. Then we come to an example of a Neurogage longitudinal analysis. This is one from one of our patients in the clinic. You can see here we have many brain regions listed left and right, and we've looked at the percent change over time, annualized, so it's a percentage change per year for the left hemisphere of the brain and the right hemisphere of the brain. And associated with that, we have the normative percentile rank to tell you if the rate of brain volume change was normal or abnormal. And you can see multiple pink areas here, 8 pink areas where there is abnormal brain volume change in this unfortunate patient. You can see that the whole brain parenchyma means tissue, that is not the ventricles and not the cerebrospinal fluid. So the whole brain tissue shrunk 7.36% per year at that rate over this time period studied. And that was at the 1.08 normative percentile, which is abnormally low. That means the whole brain shrank too fast. The forebrain parenchyma was similar. The gray matter shrunk too fast, and that was at 9.6% per year rate of shrinking. Subcortical nuclei and infrontatorial regions, which are lower brain regions, shrunk too fast, as did the brainstem and nucleus accumbens. Then we have the lateral ventricle left and right. Well, that got big abnormally fast. As I said earlier in this talk, the reason it got big was because the brain tissue around the ventricle was shrinking, and that's why the ventricle's enlarged by default. We've done a few studies of longitudinal brain volume change over time in our patients, and we've found that the brain does shrink in patients with chronic mild traumatic brain injury. This is very important because a few years ago, we didn't really know that. 10 or more years ago, we thought the brain volume was normal in patients with mild traumatic brain injury. And first of all, if you have a very brief brain injury, maybe from a sports concussion, you may fully recover and you may not have any abnormal brain volume, at least not after a couple of weeks or so. That's quite possible. But then there's a subset of patients, it could be anywhere between 15 to 50% of patients, depending on the setting. For example, in emergency room settings, it may be toward the higher range of that, where if you have a mild traumatic brain injury, you can have symptoms for many months, years, or even the rest of your life. Those are the kind of patients that come to my clinic. In patients like that, if you just look at the brain MRI, it looks normal. But if you measure the volume, especially measure change over time, you'll find it's not normal. And that's what we found with our studies, and other people have also been finding this as well. And we found not only did the brain shrink abnormally fast in our patients, but greater rates of atrophy correlated with worse functional outcome. Now that means basically, it sounds bad if your brain's shrinking abnormally fast, but is it really bad? And the answer to that question is yes, it is really bad, because it correlates with things like not being able to return to work, or not being able to return to normal family or social relationships. And these findings were essentially replicated by Dr. Zhao and colleagues in 2013, and they found that faster rates of brain shrinking were correlated with worse cognitive ability. So it all sticks together really well, and it's all very concerning for our patients. But it's also helpful to know what's happening to the brains in our patients. Here's some of the data from our study that we were just talking about, which gives you a little more detail of multiple brain regions we studied. And the majority of them showed abnormal brain shrinking over time. And then this table gives you more detail about the fact that higher rates of brain shrinking correlate with worse functional outcome. These are very large statistical effects and highly statistically significant. Thank you for your attention.